Hello everybody, I am Tuấn Dương and today I'm gonna present about the using of grow nanoparticles in drug delivery system. As we might know, nanotechnology has become more and more potentially used in medical field. Advances in nanotechnology have led to new and improved nanomaterials in biomedical applications. Common nanomaterials applicable in biomedical applications include liposomes, polymeric micelles, graphene, carbon nanotubes, quantum dots, gold nanoparticles, and so on. Among them, gold nanoparticles have been considered as the most interesting nanomaterial because of its unique optical, electronic, sensing, and biochemical properties. Gold nanoparticles have been potentially applied for medical imaging, drug delivery, tumor therapy in the early detection, diagnosis, and also treatment of other diseases. Today, we will zoom in and discuss its drug delivery applications. So, why do we need drug delivery? First, that kind of system helps us bring the drug to the right target, possibly tumor cells or a disease site in general. Thus prevents wasting drug by wrong targeting. Second, most of the drugs are non-toxic, and because of that, those drugs can kill not only tumor cells but also healthy cells, which we don't want to happen. So, by packing them with nanoparticles or drug carriers, we can save innocent cells. Generally, the drug delivery system will be designed to reach the target through one of the two strategies, passive or active targeting. In passive targeting strategy, we make use of the enhanced permeability and retention effect, which shows that in blood vessels inside our body, within tumor tissue region, the endothelial cells are not continuous, and therefore the nanoparticles can get out of the vessels through the nanoscale pores and carry drugs to the tumor cells. That phenomenon doesn't appear within normal tissue region, so the drugs will be kept away from the healthy cells. On the other hand, the active targeting can be achieved by molecular recognition of the disease cells by various signature molecules overexpressed at the disease site, either via the ligand receptor, antigen-antibody interactions, or by targeting through aptamers. The therapeutic agent can be actively targeted by conjugating the carrier with a cell or tissue-specific ligand, thereby allowing the preferential accumulation of the drug at the disease site. So, the submicron size range of nanosystems, as well as the ability of conjugate different targeting ligands, offers excellent opportunities to bridge the physiological barriers and access different tissues, followed by an efficient cellular uptake and intracellular internalization. It is also found that numerous cancer cells express lectins on the cell surface that can be actively targeted using sugar molecules. Therefore, we can also make use of that to design targeting ligands. The most common used today are lactose, mannose, and galactose. So, why gold nanoparticles are preferred nanomaterial? Among the various nanomaterials described above, the biomedical use of metallic nanoparticles, especially gold nanoparticles, has piqued interest as they offer manifest advantages. Firstly, we can easily synthesize various shapes of gold nanoparticles with sizes ranging from 1 to 100 nanometer, such as spherical, rod-like, cage-like, and so on. The optical and electrical properties of gold nanoparticles greatly depend on their shapes and size. Secondly, due to the presence of a negative charge on gold nanoparticles, they can be easily functionalized with all kinds of biomolecules, such as drug, genes, and targeting ligands. Thirdly, gold nanoparticles are biocompatible and non-toxic. Fourthly, gold nanoparticles have distinct surface effect, ultra small size, macroscopic quantum tunneling effect, and the presence of surface plasma resonance bands. All of these particular properties have made gold nanoparticle become the most potential material for various biomedical applications, including biosensing, molecular imaging, and of course, drug carrier. Gold nanoparticle can be synthesized by a variety of methods. One of the most common one is Brust method. This method was discovered by Brust and Schifrin in the early 1990s and can be used to produce gold nanoparticles in organic liquids that are normally not miscible with water like toluene. It involves the reaction of the chloroauric acid solution with tetraoctyl ammonium bromide or TOAB solution in toluene and sodium borohydride as an anticoagulant and a reducing agent, respectively. Here, the spherical gold nanoparticle will be from 2 to 6 nanometer in diameter. The sodium borohydride is reducing agent and TOAB is both the phase transfer catalyst and the stabilizing agent. In drug delivery applications, the spherical gold nanoparticles are the most widely used gold nanostructure. Regarding drug loading process, depends on the molecules we want the gold nanoparticles to carry. We can directly conjugate them with gold nanoparticle via ionic bonding, covalent bonding, or even by physical absorption. After reaching the right target, One of the last, but probably the most important step is releasing the drug. Basically, in drug delivery systems, they design drugs to be released through either external stimuli such as light, temperature, magnetic field, etc., or internal stimuli such as changes in pH and glutathione. With Go nanoparticles, people commonly use light and temperature to release the drug. Here we can see a simple diagram of Sadiki published in 2018 on nanoscale research letters. Go nanoparticles and drug absorb light energy. Light energy is converted into thermal, and then the nanoparticles and drug get hotter. Drug be released and destroy the target. On the other hand, based on the fact that there is a difference between concentration of glutathione and also pH found in extracellular and intracellular compartments between tumor and healthy tissues. We make use of that and design the suitable drug release trigger. It can be the disulfide bond, which are supposed to be rapidly cleaved by glutathione, or acid-sensitive bonds whose cleavage can enable the release of the molecule anchor at the backbone of polymer, the modification of polymer charge, or the targeting ligand's exposure. In conclusion, along with many other nanoparticles which are being developed by medical applications, Go nanoparticles are more and more widely used because of its unique properties. Not only in drug delivery can Go nanoparticle contribute, it can also be applied to many other fields like imaging or diagnostic applications. However, there is still a long way to go when we think about improving this material. So here's the future work. First, we want to make Go nanoparticles multifunctional, then can carry more different molecules. Second, the Go nanoparticle formulations need to be fine-tuned and tailored to obtain optimized therapeutic combinations. Modeling Go nanoparticles with design property should be warranted, and subsequently we can develop a procedure to synthesize the theoretically predicted nanostructure. Last but not least, like any other drug carriers, we need to solve the problem of taking it out of the body after it finishes releasing drugs. That is a huge job, and in the near future, first thing we can do is to evaluate the toxicity of the particles in the long term, and also try to improve efficacy so that we can use less carriers and drugs to reach the expected result. That's the end of my presentation. Here is the list of papers I use as references for the videos and highly recommend regarding the topic we have discussed. Thank you for your listening. I hope that you will enjoy my video and have a nice day.